Hi. So I am coming from social finance. I'll actually just introduce who we are because I'm sure many of you haven't heard of us. We are a kind of non-profit organization that's focused on just improving how we fund entrenched social issues with the aim of getting to better outcomes. And we work with a range of organizations from the financial community to government as well as social sector, bringing together those players to find kind of new solutions. I think the product that we're best known for, that Marianne was kind of referring to, is the impact bond model, social impact bonds. They are essentially, as Marianne said, an outcomes-based contract. So a donor chooses to say, we will pay we will pay a service provider if they achieve X, Y, Z outcome. And that has the great benefit of enabling service providers to have a lot of flexibility about what they do, to think about the outcome rather than the inputs and processes that they're often constrained by, to choose exactly how they want to do it and have that longer term perspective. The challenge it creates is that obviously people need money to deliver their programs, and if you're not going to pay on outcomes, there can be a long time lag. So the second thing we do is we bring in investment to fill that gap, and we bring in investors. And so what we hope that this will achieve is more adaptive program implementation and better outcomes. And this was first launched as an instrument in 2010 at a prison in the UK with the aim of reducing reoffending. And that program in its kind of first cohort was able to reduce reoffending by 10% relative to the national baseline. So quite successful, I think, in achieving target outcomes. Just to give you a sense of how it works, essentially once you've set up one of these contracts, you have an investor, they provide the finance. There's often an intermediary who then funnels that finance down to service providers. Service providers are kind of requested to be giving back their data all the time on how they're performing. So just like a company operates on a quarterly basis, the service providers will report back on their metrics, how they're progressing, use that approach to help them improve how the program is implemented. Hopefully outcomes are achieved, they're then independently verified, and that triggers a payment from donors to pay back those investors for the capital they provided up front. So the aim is to create the kind of incentives and the flexibility that's required for program implementation. The idea has been around for 5 years. Since then, there's been kind of almost 50 impact bonds to the value of $150 million launched. Most of those are in developed countries. What our team does at Social Finance is try to take that model and think about how we could apply it in an international development context, which obviously has different challenges. And so what I've put up there is an example that the team has been working on with DFID, looking at sleeping sickness in Uganda. Sleeping sickness is, I guess, a difficult parasite to treat because you have to do it at scale. And you have to combine both your treatment of your cows, which contain the parasite, with ongoing preventative measures that are kind of the spray. And so what this program tries to do is make sure that we have a coordinated delivery, that our short-term outcomes are actually, or our outputs of cows are working towards our long-term outcome of parasite reduction. And that's a program that has been piloted across Uganda and is kind of working towards to launching it at scale. We also have recently been doing a lot more thinking, which I think is relevant to this section, on how you can also use these models to grow social enterprises. So there's been a lot of talk about how the private sector can achieve social outcomes. There are a lot of, and I think earlier today, there are a lot of water filter companies and other companies presenting different technologies that they like to sell to lower income consumers. We think that's really exciting. But we also sometimes see that there are challenges in I guess, different challenges that can emerge. So for example, one challenge that we found in terms of servicing low-income consumers in India, and this is for energy, but one challenge is setting up your distribution networks. And so what we're using is a variation of this model, which essentially pays companies for the outcomes that they achieve. So if you serve a low-income household, you would get an outcomes payment. We're setting that up for a period of time until you're able to kind of have rural distribution networks that are of a level of scale that are sustainable. So helping develop kind of sustainable businesses and leverage the private sector to serve those low-income consumers. I have had a little bit of experience in the wash space, but I'm not an expert like you all, but we've done some initial thinking about how you could apply these models in wash. So we were working with the Fred Hollows Foundation on eye health and how you could apply some of these principles in eye health. And what we noticed was trachoma, which I'm sure many of you are aware of, is a leading cause of blindness in children. And actually, it's very, very cheap to treat trachoma. It's just complicated to treat because you have to coordinate your preventative measures in terms of wash with your actual treatment of people who have the infection with surgery and antibiotics. And that requires a very coordinated delivery, and it requires, I think quite a concentrated effort in the particular areas. And so, we had some initial thinking with Fred Hollows that actually this is an exciting area for an impact bond because this is a complex delivery where you want to be adaptive. You want to adapt your program delivery based on how the parasite or the disease is moving. And you want to make sure you coordinate your public and private sector players. And so that's a kind of application that could be quite exciting. And the more kind of inclusive business side, having worked with, water filter companies in India, also other people like bio-toilet companies, for instance, a lot of the challenges those companies have is they have this great product, which is great for the emerging kind of middle class, but is a bit too expensive for your lower income consumer. So potentially, there's an opportunity for donors to say, okay, well, you've got a great company, you're operating in these areas, but you're not servicing the people who earn less than $2 a day. So we will give you a kind of a subsidy to offset the price that you'll have to discount it for to reach that lower income consumer. And so there's a potential role to use an outcomes fund to help grow kind of inclusive businesses. So they are, I guess, a few ideas in terms of how this could be relevant, but I'd love to kind of have feedback from you all in terms of your perspective or concerns of applying these types of approaches.